Thank you so much, Michelle, and thank you so much to the organizers of this meeting. It's really exciting to be a part of this conversation and a roundtable that is focused on health communication and the importance, the critical importance of health communication. So I want to talk to you a bit about the 2x2 project, which is an effort sponsored by the Department of Epidemiology at Columbia University's Mailman School of Public Health. We're uniquely positioned to take on this kind of project, a rather ambitious health communications project, which is a bit different from the kind of health communication projects that we've heard about before. It's kind of a blend of many things. But our department is unique in that it has, as one of its arms of its mission, an express focus on translation. We strongly believe in our department that we have a responsibility as scientists and as population health scientists to translate our work to a broader lay audience. And scientists are notoriously bad at translating their work to a broader lay audience. And so I'm going to talk a little bit about what we're doing to train and empower a future generation of health communicators. So our express mission at the 2x2 project, and the website is www.the2x2project.org. You can also follow us on Facebook and on Twitter. Our express mission is to translate what we consider emerging public health science to an educated, admittedly an educated lay audience, so we can elevate and shape public health discourse and thereby increasing our chances of translating research into practice, so focusing on the impact of public health science. And we do this in a couple of ways. One way is by covering public health issues that are overtly public health in nature. So when we think about obesity, for example, that's an overtly public health kind of issue. But we're also very interested in drawing out the public health relevance of issues that aren't necessarily conceived of at their core as being public health related. I mean, I think this is absolutely key to the conversation and public health discourse around the social determinants of health, that people don't often conceive of what we call the determinants of health. So poverty and some of those key drivers and education that people don't think of as being expressly public health issues, that they are absolutely public health issues. Gun violence is another example, and I will talk a bit about some of the content that we have produced that really try to capture the public health relevance of these issues that aren't necessarily conceived as such. And the way that we think about blending science and communication is really this mantra that stories are strengthened by data and data are more powerful in the context of stories. So we're expressly focused on telling stories, whether that's a visually driven story using data visualization or what we call data bites, or some really hard-hitting long-form journalism. So we do the whole range of those kinds of things. And I'll talk a bit about how this actually relates to social media, because that's a key component in shaping public health conversations across our digital community. We're no longer just bound to our zip codes, but we are a community of IP addresses that are banded together by social media and social networks. So who we are, I'm the editor-in-chief of the 2x2 project. I've been in that capacity for a couple of years. We've been live since September of 2012. I'm also joined by our Associate Director of Communications in our department, Elaine Meyer, who is a Columbia-trained journalist. And we have a fellowship program that I'll tell you a bit about that, again, seeks to train and empower a future generation of health communicators. So we're now in our third cohort. We have four to five fellows annually that we support their efforts in doing this. And I'll tell you a bit about the fellowship as we move on. But first I want to talk a little bit about some content that we have produced. And I see that somehow there are some missing frames that the images didn't quite download, but I'll tell you a bit about it. So I mentioned long-form journalism. We recently had a week's worth of content that was focused specifically on drawing out the population health relevance of internet addiction, gambling, and gaming, and really exploring through a kind of a prismatic coverage of these issues what a public health problem in the making looks like. So the public health perils of legalized gambling and the addictive properties of the internet. So this particular piece, Gambling with America's Health, is just an outstanding long-form piece that was produced by one of our staff members, Elaine Meyer. It's a brilliant example of in-depth, hard-hitting reporting. And in fact, this piece ended up being shared by Pacific Standard, so they cross-posted this particular piece. So we had the opportunity to develop a relationship with Pacific Standard through the process of producing this long-form journalism that really broadened our reach and potential impact with this particular long-form story. Another way that we like to communicate about health is by employing certain antics, I think, that are particularly relevant in today's social media landscape. And so in order to cover the issue of celebrity sponsors, celebrity endorsements of things that are really bad for your health. So in this case, LeBron James's endorsement of Coca-Cola and McDonald's. One way of addressing that issue, of course, would be to write a news story about it. Another way, which we elected to go in this piece that one of our contributors, Abdul El Sayed, one of the ways he elected to go about doing this was by writing an open letter to LeBron James, urging him to drop his endorsement with Coca-Cola and McDonald's, and underscoring the data and the potential public health impact of what celebrity endorsements could, how that's affecting our health in a negative way. We had multiple different ways of addressing this issue on social media. So, for example, we worked with a graphic designer who created a series of imminently shareable pieces. What if LeBron James consumed as much sugar as he was peddling? So you can imagine LeBron James was as big as a house. That led to a potential collaboration with the Center for Science in the Public Interest, who we were ultimately thwarted in our campaign. We were going to also launch a campaign targeting Beyonce, for example, with her endorsements of Pepsi. There were some legal issues involved in all of this, but nonetheless, I think one of the things I think to emphasize about social media in this particular regard is the fact that there's an enormous amount of room for creativity. It is an intensely visual landscape, and there's lots of opportunities to convey public health messages and communicate effectively public health research and data to a broader audience. So we also cover in our content news analyses of stories. So we look at how the media actually covers issues related to population health. In this particular piece, which has gotten well over 40,000 views on our site, deals with this issue of overlooked public health issues or overhyped public health issues. Population health is plagued, and I think not just population health, but medicine and population health are plagued with a constant turning over of evidence, right? So it's really difficult to keep pace with the most current research. But one of the perils of keeping pace with the most current research is that it can completely overturn your message. And I think that that we have a responsibility to communicate effectively and to address that context of a shifting evidence base so that, and I can't keep up with it, what's the latest on hormone replacement therapy? We don't know, it's difficult to keep up with it. It's good for you, it's bad for you, it's good for you, it's bad. And I'm not sure where we are in this particular tide. But in an evolving landscape of health information, social media is particularly important in keeping pace with that research and also doing it in a responsible way and putting it into a context of this is a changing message, this is a shifting evidence base. And so one of the things that we try to do with the 2x2 project is cover the way that public health research is portrayed in the media and to play off of and dispel some of the ways in which public health can be portrayed in the media. I'm sorry, this is blank. We're going to have to skip that. We also have a relationship with Frontline. So Frontline will send us their health-related documentaries, and we review them as well. And so one of the things that we're very interested in, and again, key to the social media landscape, is in engaging in what's important in popular culture. And obviously, also, in the past several days, the NFL has been the object of much ire for players who have engaged in domestic violence and also child abuse. But, lest we forget the fact that that there is an emerging epidemic of concussions and potentially leading to a real game changer for brain health and the consequences of traumatic brain injury. That's starting, as early as Pee Wee football. And so we try to cover these issues and draw out the public health relevance of these kinds of issues that are so central to American culture and kind of the fabric of the United States. And indeed, we can think about this as a potential global epidemic, because sports-related injuries are not just happening in the US, but they're happening globally. And this is definitely an epidemic in the making. So we're proud to be a partner with Frontline in covering and reviewing their health-related documentaries, League of Denial being one of them. Sorry about that. Those were actually about gun violence, and I was going to talk a bit about gun violence. That we spent a week framing gun violence as a public health issue, and the way in which we did that is by leading with a background on the history and politics of framing gun health or gun violence rather as a health issue, and some of the shocking revelations about gun violence. For example, that the CDC is not meant to or not allowed to actually cover gun violence as a health issue due to some extreme lobbying efforts on behalf of the NRA and other groups. And we also looked at, for example, the role of advertising in shaping gun violence as a public health issue, both campaigns against gun violence and also campaigns from lobbying organizations like the NRA or Cricket Rifles, for example, that are very much leading children into and making gun ownership and shooting very attractive to children, targeting children specifically. So it was a very prismatic lens, I think, through which we were able to look at this issue as a public health issue. So I'm going to tell you a bit about our fellowship called the Communicating Health and Epidemiology Fellowship, or CHEF as we like to call them. This is a 12-month cooperative learning experience. We do currently have 5 fellows because we had one who stayed on, an additional person who decided that it was okay not to get paid because she wanted to be a part of this. But we go through, they work for us about 15 to 20 hours a week. They're students, we had a communications professional last year, or they're staff that are affiliated with Columbia, or we've even had one outside person who came to us, someone who worked with Cory Booker for years and years as one of his media relations people. And they receive didactic training. So they spend a summer, essentially, the first summer that they're in the fellowship, taking a course on communicating public health to lay audiences. And that's a week-long intensive course, and then they get targeted training, specifically in multiple targeted trainings on social media. And so each fellow, not only do they write for the 2x2 project, but they also, they man or woman our social media arm. And so they get training specifically about how to effectively start and stoke conversations across our multiple digital platforms. So Twitter, Facebook, Instagram, and soon to be adopted audio version of social media called Clamor. And we also do other kinds of targeted trainings about finding your voice and generating commentary, effective commentaries that seek to really shift the dial on issues related to population health. We have a very democratic style of collaboration. The way that I organize our fellows and address issues and make decisions about issues that we want to cover in population health is through a think tank style collaboration, which I call Idea Lab. It's a very elbows on the table. We meet for 2 hours every week. We talk about issues, we keep up with the news, and we really get down to the bare bones about what we're interested in covering and interesting and unique ways of covering population health issues that we think will be effectively pushed across the social media landscape. So as I mentioned, we're currently on 3 social media platforms, Twitter, Facebook, and Instagram. And just a note about an emerging audio platform, and I'll talk a little bit about this when I talk about strategies around social media. There's a new platform emerging called Clamor, that's C-L-A-M-M-R, and it's filling in a space that has been largely neglected recently, which is the audio space. And so we're going to tap into those folks who use podcasts and who are bent towards digesting content through an audio kind of landscape as opposed to a visual kind of landscape. So we're adding that particular platform to our social media complement. So one of the things that we've really learned in the 3 years that going on 3 years that we've been live is that social media, and I think that Carlos will talk about this, is that social media and successful social media strategies rely heavily on building relationships, not simply promoting our content. The way that we think about this is that the conversation that's generated about public health issues is our product. And so it's not just views on a page, but it is engagement and the building of relationships and that ensuing conversation about public health issues. That's the product that we're after. And so there are multiple ways that we can generate and enhance those conversations across the digital scapes that we have. And it's amazing that our readership and the people who are engaged with us on social media certainly aren't confined to New York City. They're not confined to the US. This is a global conversation that we're trying to foster engagement in about population health. Of course, the local matters. That's what gives sort of flesh to that skeleton. But the beauty of the digital landscape is that it is inherently global. So we really try to create content in order to maximize shareability. Again, I think for platforms like Twitter and Facebook and Instagram, they're very visually driven, if not exclusively visually driven, social media platforms, and certainly the economy of 140 characters in Twitter, I think forces us to, if we have multiple fellows who are engaging on social media to try and stoke conversations about population health, it's important for us to have a unified voice so that you can have individuals who shape these conversations around public health, but there is a unique and unified voice that the 2x2 Project has in shaping these conversations across the digital landscape. The other way that we do this in terms of not just producing visually driven content, but tacking on to the news, being relevant, hijacking the news, as the op-ed project likes to say, a fellow in the Public Voices Fellowship at Columbia, and so that's their term, hijacking the news. But we're interested in hijacking the news because we want to be both timely and effective in the way that we cover the news. And one of the things that we do in hijacking the news, which we're now starting to do over social media, is that we have a feature called Fresh, and that's PHRESH, PH meaning population health. And we're interested in having the fellows essentially tag the news. So it's like a week in review. So what's been going on in public health news during that week? Is it a public health win? Is it a public health fail? Is it hot news? And so we essentially tag the news and hijack the news in that way. And in that way, we stay abreast of how population health is being portrayed in the news, what issues are being brought to light, where are the gaps? Are there issues that we think are particularly important that somehow aren't getting coverage? And so how do we fill those gaps as well?
So Dana, I think that's a great conversation for us to have at the break. And so I just want to give you a warning because we have a couple minutes left, and then we're going to move to Carlos, and then we'll bring it back for the rest of the conversation after lunch.
So two more notes on, or actually just one more, because I've talked about new social media platforms, but optimizing form for function. It used to be that if people were consuming digital news, they were consuming it through, and digital content, they were consuming it through their computer. But as we know, that's not happening. So we need to be mobile optimized. And we're relaunching our site in about 3 weeks on a mobile optimized platform. So social media, incredibly important to have a mobile optimized site in order to enhance the probability that people are actually going to have those conversations in a digital space. So finally, the last point that I want to make is that one way that we cover emerging public health science is by live tweeting. I've been doing a lot of live tweeting of this particular event, and we live tweet the American Public Health Association annual meetings. We did it last year, and we're doing it again this year. It's a way that we can create digestible content for people who either are there and to foster those networks, or who cannot participate but are interested in emerging public health science. So thank you very much for your attention, and I'm really looking forward to our conversation.
Thank you so much, Dana. And again, we're going to hear from Carlos now and be jotting down those questions that you have for us so that we can continue the conversation.